welcome you all to this session of experience of multiple sclerosis with Ayurveda. I would like to first extend my very sincere thanks to Deutsche, Multiple Sklerose Gesellschaft, Landesverband, Berlin. So I'll proceed with the basic introduction of things with the idea of symptoms, prevalences, classification, Ayurvedic view, causes and treatments and prevention steps, how can be applicable in the condition of multiple sclerosis. So let's go one by one. As an introduction, multiple sclerosis is a chronic autoimmune disease of the central nervous system, like all of you know, where the cause of the disease is unclear and there is no clear cure is explained in the Western medical system. In Ayurveda, MS can be correlated with Vata Vyadhi, where a neurological disease, where Vata dosha, which is involving the neurological status of the body, where Ojas depletion, which is affecting the immune system of a person, causing autoimmune reactions, and the ama, the toxic accumulation in the body, blocking the channels or srotas, which is leading to demyelination of nerves or demyelination and nerve damage. So Ayurveda clear-cut connection between gut and brain axis as one of the cause. So the treatment in Ayurveda is also mainly focusing in rechannelizing this gut-brain axis. So there are some of the symptoms I have picturizing here in this slide. The symptoms of MS, which is affecting the central nervous system, affecting the visual areas, affecting the speech, affecting the throat or swallowing of the food, the musculoskeletal areas, the sensation, the bowel or bladder control are the common areas where this disease is affecting. So this is the clinical aspect most of you know from different explanations. So the prevalence of the disease, the informations which I have collected from different data says that this disease usually appears in adults in their late 20s or in early 30s. MS is the most common autoimmune or neurodegenerative disorder of the central nervous system. The disease is comparatively from the data more common in women. As of 2010, the number of people with MS was around 2 to 2.5 million, and the death rate as per this date is around 18,000 deaths happens that year with this disease. So it all shows that MS is not an individually affecting disease. It is affecting the quality of life of a person, the quality of life of the whole family is affected in this condition. A disease with a maximum chronicity and also a maximum expenditure to manage this condition. The modern classification of multiple sclerosis is, like you might know from the informations available, relapsing remitting, the attack of a severe condition relapsed by different reason, a primary progressive multiple sclerosis, a secondary progressive, and a progressive relapsing multiple sclerosis. These are just data I am sharing you just to get into the topic. The Ayurvedic view, how Ayurveda see this multiple sclerosis as a condition as Vata Vyati. That means the neurological arrangement in the body is affected, which is caused by the degenerative changes which is happening in the nerves or in the ligaments or weakening the immune system. So the whole complex presentation of this disease resulting in Majja Dhatu Kshaya, that means not only the bone marrow is also affected, where symptoms of osteoporosis or giddiness or dimness or diminution of the vision is affected, where Kapha Kshaya, that is one of the other dosha which is correlated with the stability of the body, where empty feeling or muscle tissue weakness, palpitation, and laxity of the joints are considered to be the symptoms. And finally, the Ojo Kshaya, that means the clear weakness in the immune system leading to phobias, loss of strength, excessive thoughts, sensory disturbances, confusion, increased dryness of the body, and exhaustion. So, this is the way Ayurveda established the presentation of this disease under the heading of Vata Vyadhi, but it is not only limited to one of the doshas, it is in multiple level of the doshas, multiple level of the tissues are involved in this condition. So, how this disease is caused? The cause of multiple sclerosis is clearly unknown as per the disease. But according to Ayurveda, there are some causes which are explained as the reason of Vata Vyadhis or Vata related or neurological disorders. So, Ayurveda says due to wrong food habits, maybe wrong combinations of food. Ayurveda says it's not good to combine cold and warm food together, cooked and raw food together, different sets of animal proteins together. Milk should not be mixed with salty, sour, and spices. These combination all can overload your gut. When you ignore these combination rules, in long run, it can make the digestion discomfort. Eating in wrong timings. Ayurveda says morning time when the nature and the body is cold, one have to eat a warm meal. One have to consider lunch as the main meal time of the day, and dinner should be the lightest meal of the day. Eating before the previous food is digested, a minimum gap of 4 hours between two main meals, or 2 to 2.5 hours between one main meal and a mini meal is very important. Space need to be maintained for the proper digestion of food. If it is not taken in attention, that can also lead into metabolic stress, unhealthy fasting, that skipping the food, skipping the right concept of eating for a long duration of time without medical supervision, eating under stress. Of course, we all know the influence of cortisol and adrenaline can also affect the digestive distress, unhealthy stress, genetically modified food items, unwholesome lifestyle practices, specifically with wrong sleep patterns. That means not sleeping at night or sleeping excessively in the day, excessively doing exercises or not doing exercises, physical and mental stress, people with impaired digestive system, people with overloaded digestive system, and excess consumption of fast food, etc., are considered in Ayurveda as the reason for formation of metabolic toxins in the body, and that could be considered as one of the reason of Vata Vyadhis or neurological diseases. So Ayurveda primarily, when a patient comes with such diseases, we will detailedly go through their diet habits, their lifestyle practices, their digestion and metabolism is assessed to plan the treatment. So the treatment is focused in Ayurveda, as I said, managing the gut brain barrier. So the main focus of the treatment is carried out through the gut, through improving the metabolism and the digestion. So there are a set of herbal combinations in Ayurveda which are primarily given as herbal medicines to improve the digestion and metabolism so that the metabolic distress in the body can be managed. The next step is shodhana or purification. So after the digestive situation is maintained, the patient is given cleansing therapies like a mrudu shodhana, means a mild evacuation of the gut using medicated castor oil with milk or medicated castor oil with ginger juice or enema or rectal administration of herbal combinations or nasal administration of herbal medicines which can stimulate the brain cells and to cleanse or to reach the brain level for the neurotransmitters to be activated in managing this disease. So primarily the gut is released. Secondarily, the cleansing level is done in the gut level, and finally Brahmana or strengthening treatments like ashwagandha or different sets of medicines which are very efficient in maintaining the neurological health and well-being of a person. So this is a classification of treatment in Ayurveda, primarily to improve the gut health, secondarily to cleanse, and finally to strengthen the system. Very specially, individually formulated herbs are used in treating multiple sclerosis cases. So we have in our clinic our own pharmacy. It's a GMP certified pharmacy where each medicine is formulated individually on the requirement of the patient, directly under the supervision of the doctors. Each medicine is prepared which have a high potency in supporting the healing process, which has the biomolecules which can reach the blood-brain barrier and give a good, efficient result in treating such diseases. Next, we go to the treatment aspect in multiple sclerosis. So I hope you can follow me and the screen is visible. Am I audible?
Yes.
Okay, perfect. Okay, I'll proceed. The treatment aspect in multiple sclerosis is also classified in 3 levels. First is Ruksha Chikilsa or drying treatment. What exactly are drying treatments means? Ayurveda says in most of the diseases and in specific reference to neurological conditions, an association of inflammation is seen in most of the cases. So the primary treatments what we perform is treatments with drying object. That means medicated decoction or medicated healing mixtures are poured on the body, followed with gentle massage. And secondarily, the Ruksha Chikilsa is done with powder massage. There are special set of medicines like Triphala, Ashwagandha or Bala, which are rubbed on the body, stimulating the peripheral circulation, reactivating the energy transmission in the body to prepare the body. And the next is Snigdha Chikilsa, the oiling treatments, where we use the techniques of Abhyanga, that means a special technique of Ayurvedic massage over 107 special energy points in the body to reactivate the nerve conduction in the body, and a very specific treatment called Pirichil or oil bath, where about 3 to 4 liters of medicated oil is poured over the body with gentle stimulating massage, which can reactivate and strengthen the body. Shiro Dhara, which is one among the primary treatments what we are using in managing or treating multiple sclerosis, which reduces the cortisol level, reduces anxiety, improves the cerebral flow, and get the oiling effect in the treatment. And finally, with Brahmana Chikilsa or strengthening treatments, which includes milk bath. There are special combinations of medicines in the medium of milk is poured over the body with gentle steps of massages. Nyavarakiri, where herbal medicated rice is mixed with milk and applied over the body, giving a nourishing and strengthening effect in the body. And Shirovasti is, I would say, the king among the treatment, which is mostly done in managing Shirovasti, where an oil compress is given on the head by retaining a leather cap, which promote the myelin sheath repair, slowing the progress of MS disease and increase the coordination and mobility and deep relaxation. So these are the few of the main treatments what we are doing in managing the condition of multiple sclerosis at our centers here. So here you can have a look into different sets of treatment. What we do, this is the powder massage, also the Udvartana, the synchronized massage, the Marma massage over 107 special points, Shirodhara. Nasya is also one among the cleansing method we do to stimulate the brain cells in the healing process. So these were the visualization of the treatments, just for your reference, how the treatment is performed. And what you see now in the screen, that is the most efficient and most popular treatment what we do, or I would name it as the king among the treatment of multiple sclerosis, is called Shirovasti, where we retain a quantity of oil on the head, and this warm oil compress promote the myelin sheath repair and slow down the MS progress and improve the motor coordination and mobility and deep relaxation. So this is maintained from 30 minutes to 90 minutes for minimum 7 to 21 days, which shows a very, very efficient change in treatment with multiple sclerosis. So just a scientific explanation, a schematic presentation of hypothesized neurophysiological mechanism of Shirodhara and Shirovasti, where the effect of oil which is applied on the head or on the forehead, which shows an effect in the hypothalamus or somatosensory field or spinothalamic level, etc., to show that how the serotonin and dopamine level are influenced by the effect of this treatment, which play a major role in treating this disease, multiple sclerosis. So I'm just sharing some of the videos of the life-changing moments in the treatment of multiple sclerosis, the day one appearance of the patients who have been here. You can see the instability of the walk of the patient, and she was here for about 6 weeks' time, the first set of treatment. And after the treatment, after the full set of treatment, starting from the drying treatment, the oiling treatment, the strengthening treatment, you can see the stability, what the person has achieved after the set of treatment. And in all these cases, the treatments are repeated regularly, maintained to get to sustain the best effect of the treatments. Next, one more case for your reference. So the day one presentation of the patient, where the instability in walk, instability in balancing and coordination is very clearly visible in this condition. And after the full span of treatment, you can see the changes what they have received with this therapies what we have done. So we will have a regular assessment of the patient's mental fitness, physical fitness, walking, stability, balance, etc. are assessed and used for a comparison to bring more confidence and more progressive results in this condition. And in all these conditions, the patients are following up regularly, making the digestive correction and the treatments in a right way so that the best results are achieved. I'm just showing few of the cases for to see how the results are seen after Ayurvedic therapies. So challenges what we face in treatment of multiple sclerosis primarily is if the patient comes with totally restricted mobility. Like you see in the videos which I have shown, there the mobility was affected, but patient was still able to move. But if the total restriction of mobility is happening, we find it a little difficult to get the recovery happening. Or no bowel and bladder control. If the patient doesn't have a good control on bowel and bladder, there is also a limited reach of the cure. If dominant disease aged more than 60 years, diagnosed more than 5 years onwards, that means if the patient is already starting treatment early as possible with Ayurvedic way, the results are faster than waiting for long years to get the change or get the dominance of the disease in the body and trying to treat. And if it is associated with diseases like obesity or diabetes or other metabolic disorders, we also find it challenges to treat the condition. And the case results for your reference from 13 to 25, around 66 diagnosed cases are treated in locations in India and Germany. So we have seen about 90% of improvement in digestive impairment. Like I said, most of these cases of neurological diseases come to us either have weak digestion or constipation or associated symptoms or weak metabolic symptoms, and that is primarily corrected in the treatment, and diet and regimens are given to maintain it. And about 80% of improvement in the mobility in the cases we have treated, 75% of improvement in numbness, 75% of improvement in sleep problems, anxiety associated symptoms, 40% changes in dysarthria or dysphagia or incontinence, like if difficulty to swallow, there is slow or less results are seen if the disease is dominant, and in conditions of incontinence also up to 40% changes have been seen. And about 8 cases didn't show up for follow-up, so we have taken from the rest of the cases and a comparison data to assess the improvement of the conditions. Follow-ups are also very important, like I mentioned. Ayurveda says the cause of the disease of neurological condition could be from your dietary mistakes or your lifestyle mistake. So a proper diet is very specifically needed in this condition. So at the end of the cure, we will give the patient a very clear idea about the diet, what they have to follow on basis of their dosha predominance, a proper sleep routine, which helps the metabolic stability in the body, oil massages and oil pulling or nasal cleansing, nasya, to be done at home as a follow-up, fasting and cleansing routines, what they have to do at home to reactivate the gut health, exercises and follow-up therapies. So this is the way how we explain the people about the follow-ups needed. And on the explanation of what to eat, the Ayurvedic way we explain 50% of your meal should be dominated with fruits and vegetables and 25% protein, and limit to 25% the carbohydrates intake. So most of the time we have seen in our experience excess amount of carbohydrates is seen to be one of the reason of inflammatory diseases or inflammatory conditions or gut related problems, etc. So we motivate the people to take more as possible fruits and vegetables and limit the protein and carbohydrates level so that a easy possible digestion and metabolism happens in the body. And when to eat, like I specified in my chart about the mistakes of eating, Ayurveda classifies morning time as the cold time of the day. So the meal should be always warm and strengthening and nourishing and energy giving. Lunch is the time when pitta or the fire dominance is highly active in the body. One have to have the main meal of the day where the food is easily digested and body can absorb it. And with a good lunch, we can try to reduce the amount of dinner as much as possible, because it's again the kapha time where you have to have the lightest meal of the day. So no cold food for breakfast or dinner, just maintaining this warm meal plan for breakfast, lunch, and very easily digestible food for dinner would be the pattern of when to eat according to Ayurveda. And we also give the instruction, it's not only to consider what to eat, or it's not only to consider when to eat, it is also very important to have a rule of eating, especially eat with five senses. That means focusing on your food, appreciating the food, tasting the food, smelling the food, so that you get a very positive contact with the food, which can also give a better result of absorption in the body. And time taken for eating, so when you don't spend a time of 20 minutes to eat your meal, the food is not properly chewed and taken to the next level of digestion. So spend a minimum period of 20 minutes to have your meals, and regular timings. That means if you're having your breakfast by 8 o'clock, maintain that you're eating at least by 7:30 or 8:30. Not that one day you eat by 8 o'clock, next day you eat by 10 o'clock, next day you eat by 11 o'clock. Maintain a timing of 8 o'clock or around 8 o'clock for your breakfast, around 1 o'clock for your lunch, and around 6 o'clock for your dinner. And time between the meals, I specified that minimum period of 3.5 to 4 hours between the main meals, and minimum of 2 to 2.5 hours between a main meal and a mini meal. So I will, at the end or next slides, I will show you a ideal plan of eating, what Ayurveda says. And then drink with eating, drink warm water, sip by sip throughout the meal. This is also helpful in proper chewing and proper swallowing and proper digestion. Combinations, like I said, to avoid cold and warm food together, avoid raw and cooked food together, avoid different kinds of animal proteins together, avoid milk taken with salty, sour, and spicy meals, which can curdle or which can become sour and acidic in the body, and to have a small walk after eating. So, eating is not just having the food, eating has a rule in Ayurveda, which is the Ayurvedic way to make the food possibly or easily digested and metabolized in the body, which is very important in all the cases and with very specific reference to multiple sclerosis conditions. So, a suggested menu according to Ayurveda, we say a breakfast around 8 o'clock, a warm porridge with steamed or dried fruit and nuts, example, steamed apple, or seasonal fruits available at your country with ginger or turmeric, etc. And make sure that you avoid cold yogurt or quark or raw fruits or raw vegetables, etc. for the morning, because morning meal should be warm. And 11 o'clock, a snack or a mini meal with almonds or some soft fruit, soft nuts or fruits, apple or pomegranate or smoothies, avoiding high sour and unripe fruits. Have a mini meal so that the sugar level is not dropping and coming up and dropping, so it is maintained in a way. And if you eat something by 11 o'clock, you can target to reduce the amount of carbohydrates for lunchtime. Lunch should be always before 2 o'clock, that means before 14 o'clock, so that the pitta dominance is subsided. Warm cooked meals, vegetables, lentils, rice, potatoes, pasta with options of meat or fish. It can be the main meal of the day. Very heavy or fatty or high cold meals are also not advised in this time. 4 o'clock is also mentioned as a time of a fruit time, so that 50% of the meal can be reached with fruits and vegetables. Sugary drinks and packed snacks can be avoided. 6 o'clock or latest by 7:30, the dinner, the lightest meal of the day, light, warm meal, vegetable soup or meat soup or easily digestible food can be taken by evening. And before you go to bed, 10 o'clock, a nighttime drink, golden milk, that means turmeric with milk can be a drink. And the best time to go to bed is around 10 o'clock, so that you are sleeping in the metabolic hours and getting a possible digestion and metabolism happening. So this is a suggested menu. This will be also individually different from person to person as Vata, Pitta, and Kapha, but this will be a plan as a general suggested menu in conditions of multiple sclerosis cases. And sleep also, as I mentioned, equally important to food. Sleep is also considered to be a very specific tool in treating this disease. So we advise the people to go to bed around 10 o'clock or latest by 11, getting up around 6 o'clock or latest by 7. So this metabolic hours at night from 10 to 11 or 10 o'clock, 11 o'clock time to 2 o'clock, dominant pitta time, one have to sleep, and this heat in the body or increased heat in the body is used to digest and metabolize the food, so that need to be a peaceful time to the body so that the food is digested properly. So to support the digestion and metabolism, Ayurveda also advises in neurological conditions a fasting plan. And how to do a fasting in Ayurveda, we mention per week, a day you select, and this day you just go with a good breakfast, like we mentioned, a nutritious breakfast. You try to skip your lunch and skip your dinner. A 24 hours fasting starting from one breakfast to the next breakfast. If you find it difficult to do, the next option would be to have a breakfast, have your lunch, and try to skip your dinner. This is also a method of fasting, because some people are little worried, okay, already with the disease, I am in a degenerative phase, I am in a weak phase, so how I torture my body with fasting again? But actually, when you do the fasting, you are detoxifying your liver and regenerating the liver. So if still this pattern is difficult, the third option is have your breakfast, have your lunch, and just to have a soup in the evening. And during this fasting day, one can have drinks like herbal teas, water, buttermilk, clear soup, or fruit juices, and only one solid food. In the first fasting explanation, if you're having a normal breakfast in the whole day, you can have all these items. So only one solid food, and you're giving your liver and your metabolism a good free time so that it can be regenerated and detoxified. This is also advised in conditions. And then exercises, mainly yoga, steps, breathing exercises, pranayama, tai chi or qigong or pilates, which can bring high stability in the body, walking or swimming depending on the condition of the person. And meditation is also a very important tool to make the mind body balance. And we put forward two concepts in meditation, like gratitude, to be thankful, because as I mentioned, MS is not affecting the individual, it's almost affecting the whole family. So a small changes what is appreciated in the treatment of the disease, we ask the patient to notify this and appreciate it, so that this positive attitude can improve the mind healing effect. And forgiveness, because the disease itself will create a kind of anger in the body, and why it happened to me and why me. So such anger nature can also give a lot of negative influence in healing. So we try to motivate, including spirituality into the picture by adding on the points of gratitude and forgiveness. Cleansing, we also ask the patient to do cleansing with medicated castor oil or milk, or medicated castor oil with ginger juice, depending on the condition of the patient, or self administration of oil enema, so that the gut um, moisture is maintained, so that the absorption is well maintained, or nasya, nasal administration of medicine with a very special 101 time potentiated Kshira Bala, which is very neurotonic effect, is advisable to be done regularly. And the follow-up of cure. So we normally say the first phase of treatment, we ask the patient to come at least for 3 years regularly every year, minimum of 3 to 6 weeks of time, because each stage to come up to improve the digestion, to cleanse the body, to strengthen the body, depending on the kind of disease, it may take a longer time. So we advise the people in first phase of Ayurvedic treatments in our center, we suggest once per week to come, once per year to come for 3 to 6 weeks into 3 years. In second phase onwards, 3 to 4 weeks, once in 2 years, so that this process of healing is maintained and the achieved benefit can be maintained for longer duration. So let me conclude my session with some final information. There are prescribed preparatory and post-treatment procedures in treatment of multiple sclerosis in Ayurveda. So to have best result, intense treatments are needed, which need extra care, regular checkups, and specially trained people to administer this method of treatment. So when you try to do an Ayurveda treatment, it is very important that you should do it under expert medical supervision. A presence of an Ayurveda doctor would be always mandatory in selecting the treatment, because body is so sensitive, as we all know, cannot help if it is wrongly treated, but it can also harm your body if it is not seriously taken in the treatment sector. So, why I specify this point is there are many Ayurvedic places coming up as wellness Ayurveda, and people are just getting confused or getting diluted with the quality of authenticity of the treatment. So it's very important to find a right place to do. Ayurveda is excellent for all, but should be administered strictly under expert medical supervision. And integrating the two medical system will be the future science. So let me also share some information about our facilities. We have in India 3 centers, Ayurveda and homestay is a place where Ayurveda is given in the cover or in the protection of a family, where the family lives with you, the mother cooks the food, the people serve the food. So you are joining the comfort of a family in recovering your disease. The second and third options are Ayurveda with nature, where you are enjoying the beauty of the nature, enjoying the peace and relaxation of the nature to get the quality treatment done. And our options in Germany are Ayurveda, Madukkakuzhy Ayurveda Centrum at Kunzmann's Hotel Bad Bocklet in Germany. Since 10 years, we are operating there. It's a 5-star hotel with a premium facilities where the guests can undergo the treatments. And Madukkakuzhy Ayurveda Fontana Bad Kissingen, since last 4 years we are operating. It's also a 4-star hotel in the beautiful location of Bad Kissingen, where the authentic Ayurvedic from Ayurveda of Madukkakuzhy Ayurveda's tradition is given authentic like in India. So thank you very much for your time.